All right, this video is going to go over the pathway of blood from the heart down to the hand and back via the veins. First off, looking at the heart, we got the big aorta coming off the top here, and the veins are more anterior, so you got to move it out of the way, or rather flip it to a posterior view, and you can see the arteries better. So here we can see the transverse aorta with the branches, and if you look real close, you see 1, 2, 3 branches. On the right side, you would have the brachiocephalic trunk turning into the right subclavian, which would travel out and then become the axillary in the armpit. It stops right there on this side, so let's follow it on this side. On the left, you just have the left subclavian branching directly off the transverse aorta. That comes over, and the clavicle would be right here. That's what subclavian means, is underneath the clavicle. Once you get out here, there are lots of branches, but I want you guys to focus in on the main pathway, and it's the axillary. See where it starts to curve? That curve is the axillary artery. Then you get to a more vertical tube, and that's the brachial artery. This is where a blood pressure is taken. And the brachial artery will split into a more medial ulnar artery and a more lateral radial artery. Come down to here and you get to the palmar arches. See how there's 2 different arches? Well, one of them is deep and one of them is superficial. I'll zoom in here for you. This one out here is superficial, so it's called the superficial palmar arch. And in here it's the deep palmar arch. Coming off those would be the digital arteries going to each finger. I like to think about that as like a cul-de-sac. When you hit a cul-de-sac, the only thing you have left are typically about 5 driveways. The 5 driveways would represent the digital arteries going to each finger. All right, for the veins, it's not as simple because you have superficial veins and deep veins. Now this is a posterior view. So down here we still have the digital veins, just like we had the digital arteries. The digital veins go into 2 different arches here. One's dorsal venous arch, and the other one is more anterior on the palmar side, palmar venous arch. Now what do you notice coming off those arches? Well, we got 1, 2, 3, and look real close, 4 different main veins. Now 2 of them are superficial, but let's start deep, because the deep veins are going to correspond to the arteries. Radial artery and ulnar artery. So over here, you have ulnar vein, more medial, and the radial vein, more lateral. But what about these 2 on the outside? Well, this one here is basilic, and basilic is going to run all the way up to here. Cephalic is the more superficial lateral, and it's going to go all the way up to here. Ulnar and radial merge into brachial, so I'll freeze frame it so you can see brachial vein in the middle, basilic vein over here, and cephalic vein over here. Keep going up, the basilic feeds into the axillary vein. This would be the axillary vein right here. Cephalic goes all the way up and over and feeds into the subclavian vein. Remember, the clavicle would be right where the probe is. Let me flip it around so that you can see the final part of this pathway. And it's the subclavian vein from either side merging into number 8 here, the brachiocephalic veins, and then into the superior vena cava and back to the heart. I put a probe in here so that you can really see the difference between superficial veins. This would be cephalic, going all the way up, more lateral, and then basilic in here, more medial, but both superficial. There's one more superficial one to know, and it's this one right here. This is the one where you often get blood drawn from, and it's called the median cubital. Median cubital, this connection between cephalic and basilic.